And then we'll ask about gynecological symptoms. This tells us so much. It's so beneficial when working with women. Dysmenorrhea, dysmenorrhea. That's painful menses. Okay. When do you get cramping? Is it before your period starts, or is it after, or is it all of it? If it's before and like towards the beginning of it, that usually tells you that it's an excess, like a blood stasis or excessive cold or excessive heat. The reason is because what will happen is everything's building up, and so there's too much pressure there. Just like the same as putting pressure on pain and not putting pressure on pain. Okay, so if you put pressure on it in the sense of all of this building up, then once it starts to flow, then it's relieving that pressure and the pain goes away. Whereas if it starts towards the end of the cycle and then after the cycle is done, after the bleeding is done, that's usually a deficiency, right? Because now the blood is left and there's not enough there, and so you get pain. Is that good? Is that clear? Yeah. Good. PMS symptoms are usually related to liver qi stagnation in Chinese medicine. Of course, there's hormonal components as well. But I guarantee you, every time I have a female patient who comes in and says, oh God, my PMS was so bad this month. It's like, well, how was your stress this month? I'm like, oh, it's a really tough month. So-and-so died, or so much work problems, or got a big fight with my partner, whatever it is, it will always affect the menses, or it tends to affect the menses. We'll ask about infertility, in which case we'll look to that other stuff that we talked about, like with libido and sexual symptoms. But infertility could be many things. It could be qi deficiency. There's not enough qi. Remember, qi rises in general. The qi, when it's not rising, it sinks. And so when the qi sinks, it's not holding in the fetus. And so there's infertility. They can never hold the baby. Or they miscarriage in the first trimester. Yeah, that's one example. But yin deficiency, yang deficiency, all of those can be involved. Liver qi stagnation can be involved. Yeah. Then the type of clots tell us a lot. Small dime-sized clots, qi stagnation. That's because when the qi stagnates, the blood will stagnate as well with it, because qi moves the blood. It's the commander of the blood. So then it leads to blood being static or not moving. Then if they're bigger, quarter-sized or bigger, and round, both of these are round, they're quarter-sized and bigger, then it's just true blood stasis. It's not necessarily liver qi stagnation. And the last type of clot that we typically see is stringy clots. If they're stringy, it tells us that there's cold in the uterus. Women like this benefit greatly from doing this a couple days before their menstruation starts and leading up to like the first day or two of menstruation, is to use a moxa stick on the lower abdomen. So warm up the area.